Fevers! Are they bad? Are they good? When to worry, when not to. Let's get to it with Now You Know with Dr. O. So fevers are one of the most common concerns that parents have about their kids. And to tell you the truth, pediatricians probably stress a lot less about fevers. So I thought, let's get on the same page on fevers. First off, a fever is defined as a temperature above 100.3. Another good thing to know about fevers is they are rarely a reason to rush to an emergency room or call 911. So first, check the temp, then let's just think through some of these common concerns and questions to see if this is something you need to be worried about. So fevers typically are a sign that your body's fighting an infection, a virus, sometimes a bacteria. And it's usually a good sign that you have a good functioning immune system and your body's doing exactly what it should be doing. So the most important thing you can do when your kid has a fever is just look at some basic things like, are they staying hydrated? Are they drinking enough fluids that they're making tears, their mouth is moist, or they're still going to the restroom and urinating frequently? The other thing to look out for is that they're not being lethargic. So lethargic doesn't mean, more tired than usual. It means they're hard to wake up. It's almost like nobody's home. It's hard to keep eye contact and communicate with. Those are definitely concerns that we need to call the doctor immediately. Other things to be looking for is that they were having difficulty breathing, breathing really fast and hard, working hard, using a lot of extra muscles in their neck or in their chest to breathe. Or if they're having a severe headache, like worst headache of their life, or a stiff neck. If they had an unexplained rash that you've never seen before, those would, or if they're having vomiting or diarrhea that's pretty profuse, they're just going over and over, that could lead to dehydration. And another one that I never want to leave out is kids less than 3 months. I would always call the pediatrician for fevers at this age just to make sure, because they can't tell you, what's hurting or what's going on. So those would be another time to call your pediatrician. So I hope that brought more understanding to you about fevers. They're rarely bad. They're very rarely bad if they're not accompanied by serious signs and symptoms. When in doubt, call your pediatrician. That's what we're here for. If you want more information about Tylenol dosing or Motrin dosing, you can go to our website, pearlandpediatrics.com. I hope this was helpful. Now you know with Dr. O at Pearland Pediatrics.